Today I'm going to go through the movement restrictions, the range of motion restrictions that we put in place for our patients that have had a reverse total shoulder replacement. Why do we need to restrict movement in our patients that have recently had a reverse total shoulder replacement? It's because we need to protect muscles and tendons that have to be cut through to get the new ball and socket into the shoulder. Specifically, we need to protect a muscle called the subscapularis muscle. This is one of the rotator cuff muscles, and as I mentioned, we have to cut through it to get the new parts into the joint. So first off, I need to mention that these restrictions vary a bit from surgeon to surgeon and from patient to patient, depending on the specific procedure that's done. So be sure to work with your PT on what's best for you. So the first restriction, you need to wear the sling all the time for the first 3 to 4 weeks. Second, for the first 6 weeks after surgery, no reaching with the hurt arm. Third, also for the first 6 weeks, no carrying anything with the hurt arm, not even a cup of coffee. And last, again, 6 weeks, no pushing through the arm, pushing like you might do when getting up from a chair. Now, once we get to about the 6th post-op week, the restrictions relax quite a bit. People can reach, people can go about their day in a much more normal fashion. But we still have restrictions in place until about the 12th post-op week. And that's because that subscapularis tendon still isn't totally healed. So if we reach in certain directions far enough, we can actually cause the shoulder to dislocate. So restrictions for post-op weeks 6 to 12. No reaching overhead past about a 120-degree angle at the shoulder. No reaching out or externally rotating the shoulder past about 30 degrees. An example of this might be reaching into the back seat of the car. Also, real important, no reaching behind yourself or across yourself, and especially no putting those together. That might happen if you're reaching back to tuck in a shirt. And last, in this 6 to 12 week post-op week range, no carrying, lifting anything over about 5 pounds. Now, once we get to the 12th post-op week, most of these restrictions fall off. But there's one restriction that remains in place indefinitely, and that's no heavy lifting with that hurt side. And specifically, I advise my patients to really not lift anything more than about 15 pounds forever. Those are the range of motion restrictions that are almost always used with folks who have had a reverse total shoulder replacement. I hope you found this video helpful. I hope it helps you get back to what you love to do. Like, subscribe, send this video to a friend, and we'll see you next time.